Welcome. Today we are talking with Krysta Norwick from Cairn Physiotherapy about something that's actually really common postpartum that we really don't talk about enough or warn people enough or prepare enough. So we are talking about wrist pain in pregnancy, specifically something called de Quervain's Tenosynovitis. And this is really a repetitive strain injury. And when we're taking care of our newborns postpartum, we are using our wrists so much. And oftentimes we're not doing it in a way that is helpful or productive to our wrists. So after the intro, we're going to get into chatting a little bit about this, what it is, what it looks like, how to prevent it, and how to manage it if you do start suffering with it. So really excited to do this with Krysta from Cairn Physiotherapy.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Hey, Krysta, welcome today. I'm so excited to talk to you about something that we often don't talk enough about. People don't know anything about until it happens to them. And then it can be annoying and frightening because they don't know what's going on. And often it happens postpartum with a newborn baby and everything's going crazy. So thank you for joining me today. I just got off a 2-week break, which was amazing. And even though I look very young, I'm actually in my early 40s and I've started to develop hand arthritis, like arthritis of my fingers and my thumb, which is actually quite common in my age bracket, my demographic. And I had 2 weeks off of work pretty much, and the gym's closed thanks COVID. So 2 weeks off of like holding weights and weightlifting. And so my arthritis with a bit of rest is actually improved quite a bit. And what we're talking about today also can improve with rest. However, with a newborn baby, we're not allowed to do that. So we're going to talk a little bit today about something called de Quervain's Tenosynovitis. And I am so excited, aka wrist pain, one cause of wrist pain. And I'm so excited that you've come to talk to us, Krysta. So why don't you start by giving us a little bit of a brief intro about who you are, what you're up to, grand adventures, and then we'll get into it.
Sounds great. Thank you so much for having me, Alicia. It's always so fun to talk about these topics with you. So my name's Krysta Norwick. I'm a physiotherapist, and I run a physiotherapy clinic called Cairn Physiotherapy that's all online. I also have training in pelvic physiotherapy, so I work with a lot of pregnancy and postpartum clients. I am living in my van now full-time with my husband, and I was just telling you that we are traveling around and shipping it over to Europe. So I'm working on the road, and our goal is to travel the world. We're very excited.
So exciting. Awesome. Yeah. So postpartum is one of the times that this really pops up for people. So why don't we chat about what is de Quervain's Tenosynovitis? We'll talk a little bit about what that is, what the risk factors are, and hint, postpartum is one of them, as is pregnancy. And then we'll talk a little bit about what we can do about it, because it's a really challenging thing for people who have a newborn at home to have to manage and deal with.
Absolutely.
So why don't you tell us a little bit about de Quervain's Tenosynovitis? What are some of the symptoms that people might experience?
So generally what people might experience, and like you're saying, it is very common in the postpartum period with childcare. So taking care of the newborn baby. And it usually pops up as it feels maybe like wrist pain, thumb pain, hand pain, even might feel it up in the forearm a bit. And it could feel painful, irritated. You might even notice a little bit of swelling.
Yeah. And oftentimes it's a form of repetitive strain injury, right? And so it's with,
Exactly.
You can get it with that pinching motion of your thumb or with that lifting of baby. So we all tend to, and I am one of those people, we don't always use the best technique when we're doing things. So really, when we're lifting our babies, we should keep our wrists nice and straight. Just like when we're doing any activities that involve our whole body, we should really keep our core engaged. Most of us don't do that.
Yes.
And as a result, we get back pain and pelvic pain and et cetera, et cetera. So if we don't keep our wrists nice and engaged, we do a lot of flexion, like thumb towards arm flexion, which can really irritate both Krista and I are doing this and nobody can see us doing it. Uh,
Yeah.
I'm trying to explain it so it's like almost like giving a big thumbs up. And so
Yeah,
it
you
can
bring your
cause,
thumbs towards your forearm.
yeah, and it can cause a lot
Yeah.
of irritation and inflammation in the tendons that help that motion
Mhm.
happen. And they go under this band that goes across the wrist to keep them in place. And so that's essentially what we're talking about. That's that kind of
Yeah.
inflammation of the tendon and the sheath around the tendon that solidifies the tendon with this kind of repetitive strain injury that comes with having a new baby.
Exactly. And that motion you're talking about, where you bend at your wrist, which brings your thumb closer to your forearm, is the most common repetitive motion that we'll see with people who are caring for a newborn because of how you handle the baby and you're trying to support their head as well. So, this can happen to any caregiver, not just the birthing parent, anyone who's doing that repetitive motion. And so, what I always love to teach people before they even get to the point where they're doing that repetitive motion is how you can do that motion with less wrist movement. Can you do that same motion and move your wrists with less? You might still have a little bit of movement, but the least amount of movement you do at your wrist, like you're saying, the better, the less that tendon is going to get irritated over time. You won't notice it with 2 or 3 repetitions, but it's over weeks or sometimes months that you start to really notice that irritation happen. And so, really, what we want to try to do is keep the wrists from moving too much. So, you can even watch your wrists and see what's happening if they're moving, and bend at your elbows more if you can, because your bicep muscles that help you bend your elbows. They are stronger and the tendon is less prone to getting irritated because it's a bigger muscle that has more ability to lift that weight of the baby.
Yeah, for sure. And what prompted this podcast, us doing this, is I had an afternoon clinic and 2 of my postpartum patients came in with this. And so then I right away got on Instagram and sent Krista a note saying, hey, we have to do this. This is like something we really don't talk much about, but is relatively common. And the other
Mhm.
thing that we need to remember is it's our hormones play such a fascinating role in our bodies. And it's something that we often don't think about. But I know like during adolescence, as our hormones are shifting, during that like period just before menopause and just after menopause, I don't think I'm quite there, but technically I'm in that 10-year window. Our hormones are shifting. And during pregnancy and postpartum, our hormones are really shifting. And that can also increase the risk of any musculoskeletal injuries of happening just because of the
Yeah.
effects that it has on our joints and our tendons, our ligaments, and our muscles. And so just being in that
Mhm.
hormonal shift, which is totally normal, often impacts that as well.
Exactly, and I remember someone telling me they did something that normally was they could do no pain at all, I think it was painting, and then when they were pregnant, all of a sudden they were getting wrist pain painting, and I said this exact thing, "Well, your hormones are changing, you're more prone to musculoskeletal changes or potential irritation." So exactly.
Yeah. So why don't we talk a little bit about the risk factors? Because this isn't only pregnant and postpartum people, but who is at risk for this?
Yeah, so because it's most commonly a repetitive strain injury, anyone who is using their hands and wrists in a repetitive way can potentially develop de Quervain. Other risk factors can include things like having arthritis in the hands, which you already mentioned. So, some sort of arthritis in the region. And if your body is going through major changes, like you've talked about, so hormonal changes. Any other ones from medical side that you have, Alicia?
Yeah, so it's more common in women. The age bracket of 30 to 50, it's a little bit more common. So much more common in that age bracket, which is when a lot of people are getting pregnant in that postpartum period. And then pregnancy and postpartum, again, because of the hormonal shifts, and in pregnancy, because of that increased swelling. We all know that we all get a little bit more swollen in pregnancy. So things like carpal tunnel, which we'll do a podcast about. So that's irritation of the nerves that are flowing through our wrist kind of area, are more impacted by that swelling. So anything in a confined space are more impacted, right? Unlike our legs, there's only so much, our legs, we get swollen, but there's a little bit more room for swelling, unfortunately, because it's annoying. But in our wrist area, there's really not much extra space for that swelling to go. And so that can be part of an irritation. And in that postpartum with that shifting hormones and that, like you said, that repetitive strain. And so like your painter
Yeah.
client, right? So a normal activity got irritated because of the pregnancy, the hormones, the swelling, all of those types of things. So it's something that can pop up. And generally speaking, once the things that are irritating improve, it should also improve. But for some people, they need more support around that. So
Exactly.
yeah. So you talked a little bit about one of the things Sarah and I are learning about is our allied health colleagues and how they have so much to offer to our pregnant population, our postpartum population, physiotherapy, dietitians, counselors. There's so much capacity out there to get help and support. And so one of the things that you mentioned is actually doing like preemptive education, right? During your pregnancy physiotherapy sessions, this is one thing that you could really talk about. So let's talk a little bit about
Yeah.
how do we prevent it?
I love this. I always love talking about prevention. So, as we've talked about in previous podcasts, seeing a physiotherapist during your pregnancy is a great idea. So, you can talk about your pelvic floor, your pelvic health, your abdominals, how everything's changing during pregnancy and prepping for labor and delivery. But there's also that educational component of signs and symptoms to watch for in postpartum and how you can use your body movement. So, your body mechanics is the technical word, and prevent things like the de Quervains. So, I would teach someone during pregnancy how to lift baby without using too much wrist movement. And even if you don't quite understand and you start to realize as you're caring for baby that you are moving your wrists a lot, I've planted that seed and I'm not supposed to move my wrist a lot. I actually don't know how to do it now that I'm holding a wiggly baby. So I need to touch base with a physiotherapist and talk about strategies. And what I love about seeing clients when they actually have their baby with them in session, either on video or in clinic, depending on how it all works with timing and naps and everything, is it's actually really nice to practice lifting baby, and then the physiotherapist can watch how you're doing it and give you slight little tips and tricks for how it might work better for you.
That's why I love seeing people with their baby.
I love in session seeing somebody with their baby if that's possible. So either over video or in clinic, where we can actually work on the lifting technique. So watching you lift baby, move baby, and give different tips for how you might be able to keep your wrists more still or how you might be able to protect your wrists a little bit more. Use your elbows or your biceps a little bit more to protect your wrist. So that's the one major way is movement mechanics, so not using your wrists as much.
And I love what you said there is that preemptive education just plants a seed in somebody's brain. And that's what Sarah and I are trying to do. Like, you don't know what you don't know. So if you have a little bit of information and something pops up, you can recognize, oh, I can get help around this, or oh, I can do more research around this, or I can ask my care provider on this. So I think that's such an important piece of it, is just learning what to expect, what might happen. This may never be an issue for you, but if you've at least heard about it, you can reach out for help sooner rather than later and not suffer as much. So you talked about
100%.
moving mechanics. Yeah. So talking about that, what else do you recommend?
So the other thing that you could work on, and this might be for someone who maybe feels like their wrists are a little bit weaker to begin with or has had any sort of wrist issues in the past, would be to actually preemptively strengthen your wrists. So a physiotherapist could help you with a few strengthening exercises, which would actually strengthen both the muscle and the tendon. So the tendon tensile strength, so its ability to withstand load or tension, can be increased with certain types of exercises. So that might be something that you would want to ask your physiotherapist for, especially if you feel like you are someone who's more prone to wrist or hand irritation or pain. I have seen quite a number of people who've noticed wrist pain with doing yoga. And so if you're someone who's noticed your wrists tend to get irritated with something like yoga, then you may want to consider strengthening before the postpartum period. But there is that aspect of the hormonal changes can definitely throw the wrench in it, and you may be able to strengthen and it might help. It might not, but it's one of those things that we could try and see if it helps. And then the other thing is the fact that you're using the muscle that attaches or that ends in that tendon that gets irritated close to your, so basically it's on the thumb side of your wrist is where those tendons and the sheath is that will get irritated with the Quervain. And so the muscle that originates in your forearm might be getting tight, sore, tired from all the extra work it's doing now with looking after baby. And so right early on, you could actually start giving yourself a little gentle massage in your forearms. So you're not massaging the 3 to 4 inches close to your wrist. So from base of your thumb up into your wrist, that's where the tendons are. You would massage up closer to your elbow and you would find spots that maybe feel tight or sore. You could massage it. You could get a partner to massage it for you. And you could also ask your physiotherapist for really clear instructions because it is a little bit hard to find that tendon on your or that muscle on your own. So a physiotherapist could help you with that as well, or could actually do some treatment for you if needed. But if you preemptively massage the sore and tight muscle, that can relieve some tension that you will have through your tendon. And then you're less likely for that tendon to actually become irritated. However, if it does get irritated, that is one of the treatments that we can do is actually work on loosening the muscle to help ease any tension that's running all the way through to the end where the tendon inserts into your hand.
So that's something people could do while they're waiting to see their physio or their physician if they're starting to feel like they're getting that discomfort or that pain in that area.
Yes. And I actually have a video on my Instagram, my Cairn Physiotherapy Instagram, demonstrating that massage technique. So it is there if you want to check out the Instagram page if you are on Instagram, where I demonstrate exactly where that muscle is.
Awesome. We will. Can I post Instagram videos? I feel like we'll figure something out.
Probably.
Or we'll share it on our Instagram feed. There we go. Perfect. I'm so not tech.
Hey, Sarah,
Yes, Alicia?
did you have any problems with newborn sleep?
Oh my gosh, I sure did, especially with my first.
Me too. I wish I'd known more about what to expect going into it.
I know, and I wish that I had known to create a sleep plan with my partner.
I know. How can you support each other to get the sleep that you need while supporting your little baby?
Totally.
So guess what, guys? That's why we created the Newborn Sleep 101 course. In this course, we discuss what does newborn sleep look like and how can we help support that sweet little baby to become the best sleeper they can.
While also supporting you and your partner as you navigate this complex, sleep-deprived time.
We talk about how to set up your nursery or your bedroom to optimize both your sleep and your newborn sleep. And we also start talking about how you can start implementing routines and schedules into your day and your newborn so by the time they're 3 or 4 months, it's well established. Because guess what? That's when they start to really need it.
If you're interested in learning more, head to our website, www.shefoundhealth.com/courses.
We hope that you get better sleep than we did.
Okay, and then what about immobilization? So one of the things that I often tell people, and partly it's just I use it as a reminder, but also to help immobilizing, is getting some kind of wrist splint for de Quervains. So can you talk a little bit about whether I'm making that up and shouldn't be telling people that? Or if I'm correct, what that looks like and what people should look for?
Yes, that's a really great question. So generally with physiotherapy, our goal is to solve the issue through exercise if we can. Can I give you a few exercises, work on it, and alleviate your symptoms just by education? So modification of how you're carrying and lifting baby, and then specific exercises. However, if we've done the exercises and education and that doesn't seem to be working, the symptoms aren't getting better, then that's when a splint or a brace is something that we could consider. So that allows you to basically have support so you're not moving at your wrist as much when you're doing that caregiving baby movement lifting. So that can be really helpful because if it's preventing you from moving your wrist, then you're not going to be doing that repetitive strain movement into that tendon area as much. And sometimes that can be just so helpful in that interim when you still need to do a lot to support baby before neck control develops a bit better and their core gets stronger. And you don't actually have to do as much with the wrists in order to stabilize everything. So that can be something that just helps you get to that point where, okay, I'm past the point where I need to use my wrists as much. And it's gotten me to that point where then things have calmed down. So it's a little bit of a preference thing, and it does depend on an individual basis. If someone can't do physiotherapy, or it's not working, then that brace or a splint could be a really good option. Where I'm always cautious, and I would say probably a lot of physiotherapists would agree with me on this one, is if somebody gets really used to wearing the splint or a brace, then the muscles can start to weaken over time. So we want to be careful with not using it for too long or 100% of the time if we can avoid it, so that we're not losing any muscle strength, which can sometimes be a little bit harder to get back later. It's definitely possible, but we just want to make sure that is something we're considering. And that's where working with a physiotherapist can really help you understand how often you should wear it, when you could not wear it, what sorts of movements might be totally fine, which ones will be actually helpful, and how to find the perfect balance for you where your symptoms are managed, your pain's managed, and you're also not losing too much strength.
Yeah, and I think that's a really important thing to remember. And again, when I said I use braces, I use them often just as a reminder. So you're 100% correct. We don't want to be using them all the time for in most cases. And this is when physio is always amazing, but in really helping to guide you when if you have a period of the day that is really heavy in baby managing, then maybe you use it during those periods, and then during nap time you take it off
Right.
and you don't use it. You do your strengthening and your stretching during those times of the day, or you use it for a couple of weeks to let things help settle down, and then you get back into kind of your more kind of rehab type thing. So I think that's
Yeah.
a really important piece. And then if you've done your physio and you've done your bracing and things are still at a point that you can't manage, then the next steps might be something like a steroid injection just to help simmer things down in that area and decrease inflammation. But those also have risks with it. So it's ideally we don't need to do that because that can weaken the tissues around the tendon and the sheath as well and can cause trouble. But sometimes that allows you to things to settle down so that you can do the rehab that is necessary. If the pain is so much that you're not able to function day to day doing the things that you need to do, then sometimes that would be the next step. And then resort, and generally speaking, I've never done a steroid inject for postpartum. It's always resolved with physio and splinting and rehab. But the last result, if this is something that is like just incapacitating, you've tried everything else and surgery is an option. But I've never actually seen anybody get surgery for this. So I think that's a pretty last resort because then that has its own
Mhm.
rehab associated with it. And with a newborn, best of luck to you.
Exactly. Yes,
So let's talk
exactly.
a little bit about, so if somebody is experiencing wrist pain and they're like, is this what they're talking about? Is this not? How do I know? How do we diagnose it? Why don't you talk a little bit about what people can do to get a sense of, is this the tenosynovitis, or is this maybe something else? And how can people figure that out a little bit so that they can prompt their questions appropriately to their care providers?
Yeah, that's a great question. I think really the best way to figure out exactly what's going on is to talk to a care provider. You can go directly to a physiotherapist, and we have assessment techniques to figure out which tissue, which area in the body is giving you your symptoms. And you can talk to your primary care provider as well about it. Really, if you're experiencing wrist pain, irritation, and it's bothering you and you want to address it, then really reaching out to a care professional or physiotherapist specifically can help you get to the bottom of what's going on. And as physiotherapists, we will assess. And if it is something that we can help you with, we'll tell you. And if it's something we can't help you with, we'll also tell you. And we'll tell you who the best person would be to see. But in general, if you're experiencing on the thumb side of your wrist, and it's in the thumb, hand, wrists, or up into your forearm, and it's an aching sensation, or sometimes it can be sharp pain as well, it's most likely that. And then you know that you can probably reach out to a care professional to help you figure out further what's going on. Usually you wouldn't experience, it's not as common to experience numbness or tingling or burning sensations with this. So if you're experiencing that, it might be something else in the wrists. But again, talking with your care provider would be a great way to figure out exactly what's going on.
Yeah, and one of the tests that we do in the office, I'm going to try and describe it as I do it. I've got my hand up.
It's a
Is
tough
we
one to
we
describe.
we bend our thumb over our palm, so trying to touch the base of the pinky, and then we wrap our fingers around the thumb so that we've got a fist, and then you move your wrist towards the pinky side, so away from the thumb side. And that will often cause discomfort in that kind of, it'll almost reenact that discomfort or cause discomfort. It's causing a bit of discomfort in me. So there's going to be a little bit, and I don't have it. It's going to cause discomfort along that tendon and that sheath. So that's that area that Krysta was describing as well. So that's one of the
Exactly.
tests that we use. It's not perfect, but it's just stretching out that area that's irritated. And so if it's reenacting your pain, then chances are that's maybe one of the things that's going on. And like Krysta said, it's really hard to tell. It's something that we have to do an exam for, because there's so many things that could be going on, and maybe there's more than one thing, and we have to address both things. And so really important to, if you're struggling with anything that is causing you challenges, whether that's your thumb pain or something else, talk to a care provider, because really there's so many more things that could be going on, and we don't want to make assumptions around it being one thing and treating it, and it's not that. And I know we're struggling in the world of telehealth. I don't do videos, and I think you can do a lot over video, but of not being able to do physical exams on people. And so I think people make assumptions that we can diagnose based on just what they're saying. And no, oftentimes we need to either see you virtually or have you come in to do a proper exam to really figure out what's going on. So yeah, awesome. Is there anything else that you want? Oh, and the other thing that's important is management is pain management. So often if you're pregnant, don't take anti-inflammatories. Thank you very much. But if you're not pregnant, then anti-inflammatories can help with the pain and a bit of the swelling as well. So an ibuprofen or naproxen, which are both over the counter, that's one option. You can also got topical anti-inflammatories that you can rub over the area if you're not supposed to be using anti-inflammatories for other reasons, kidney disease, et cetera, or Tylenol. Doesn't help a ton, but it can help. So those are some other ways just to help to manage that discomfort.
Yeah. And ice, you can use some ice on the area to help with discomfort as well.
Good. So like a little ice massage. Hey, perfect.
And rest. We've already
And
mentioned
rest.
that, but rest. So when you're, obviously you have to keep caring for baby when you're doing those tasks. That's not something that you can stop doing necessarily. However, when baby's taking a nap or you're not needing to use your wrist, then giving them as good of a rest as possible. Sometimes even being on our phones can be irritating to it. If you do have the irritation going on, maybe try not to scroll too much if you can avoid it, and just give your wrists and thumbs as much of a break as you can.
And a great way of doing that is just listening to all of our podcasts. Really.
Yes, podcasts are the best way.
Hours and hours of amazing information.
Yes.
Self-promotion much. And then the other thing about that is rest is important for all things postpartum. So call in your support team. If you're struggling, ask people to come over and help you with those tasks that are irritating. Doing the dishes, folding the laundry, all that type of stuff that irritates it. Ask people if they can come and help support you for a little bit while you're working through this. And I think that's something that we also don't do. We don't reach out to our care providers with discomfort, and we don't reach out to our support team either. Really make sure that you do reach out to that. Just as a recap, 1, de Quervain's Tenosynovitis, aka wrist pain at the base of the thumb, is super common, especially postpartum. If you have a history of wrist injuries, if you have wrist pain with certain activities already, reach out to your physiotherapist when you're pregnant. Get some of those tips and tricks. If you're suffering from this, reach out to your physio or your primary care provider and ask for some help, and call in your support team to help you with tasks that are irritating it. I think that's a pretty good synopsis, hey?
That's a great synopsis.
Right? So if you're pregnant, if you know a pregnant friend, reach out to a physio, send them this podcast because this is super common. If you're postpartum and suffering from this, then reach out to your primary care provider or your physiotherapist for some tips and tricks and some support around this. So Krysta, just as a quick reminder, where can people get a hold of you?
You can find my website, cairnphysiotherapy.ca. So that's CAIRN physiotherapy.ca. And we're also on YouTube as Cairn Physiotherapy and Instagram at Cairn Physiotherapy.
Awesome. So we'll link all of that, and I will try to figure out a way to link your video on kind of that massage technique, because I think that's great, in the show notes. If not, it'll be on our Instagram. We'll link it on our Instagram page. Awesome. Thanks so much, Krysta.
Thank you so much. Have a great rest of your day.
Oh, you too. Happy journeys.
Thank you.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating.
If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.